Welcome to the Cystic Fibrosis Foundation CF Education Day, Partnering for Care, Transition to Adult CF Care. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Johns Hopkins Cystic Fibrosis Center and supported through an unrestricted educational grant from Genentech. It is a part of the Partnering for Care series that focuses on the different roles that people with CF encounter at the CF Care Center. So these highlight the healthcare professionals and their roles. And also how you or your child with CF can partner with the CF Care Center healthcare professionals to help you thrive and learn how to manage CF in your daily lives. Anyone with CF or who cares for someone with cystic fibrosis knows that it takes a team effort. This includes the person with CF, their family, their friends, and the healthcare providers at the CF Center. Partnership is when a person or persons take part in an activity with others. In this case, it's cystic fibrosis care. Partnering with your CF healthcare professional is important in order to help the person with CF learn how to manage CF care in their daily lives and not let it take over their life. This presentation will focus on how you and your teenager can be a full member of your CF care team during the transition into adult CF care. Questions from this segment were sent in from you, the community. Questions not related to this topic or that ask for medical advice will not be asked or answered. If you have a question about transition in your care center, I encourage you to talk with the members of your CF healthcare team. Additionally, you can talk to the CF Foundation by calling 800-FIGHT-CF or info@cff.org. Joining me is Dr. Peter Moygazel, who is the Center Director at Johns Hopkins Cystic Fibrosis Center, and Dr. Michael Boyle, who's the Director of the CF Adult Program at Johns Hopkins in Baltimore, Maryland. So my first question is, what are the differences between pediatric CF care and adult CF care?
That's a great place to start. I think, truthfully, there are a lot of similarities, right? But let's focus on some of the differences, and there's some important ones. One of these is that it's a subtle thing. It means we're going to be paying attention to the individual with cystic fibrosis and not to the parents. So when you come to clinic, where our chair is going to be facing you, we're going to be talking to you and not asking your parents to answer questions. I think another important difference is actually expertise in medical and non-medical area, things like lung transplantation, things like getting insurance, medical insurance, particularly on your own as you get older, perhaps cystic fibrosis-related diabetes. And then one other important thing is we're a lot less likely to have Winnie the Pooh or SpongeBob in the waiting room.
Ah, SpongeBob. So what are the benefits to moving from pediatric care to adult care?
Well, this is a key one, and I'm actually going to talk to parents a little bit here because I think the natural tendency is to feel comfortable with the people that you've been with, the people that have been giving great care, the pediatricians. But you know, transitioning to adult care is important because it sends a signal to your son or your daughter that it's time to develop some self-responsibility, to make sure that they take the disease on for themselves and not just have it be something that belongs to their parents. There's also some other advantages because the team has some expertise. Obviously, there's a lot of similarities between the adult and the pediatric team, but the adult team tends to have more experience with some of the things we talked about, things like diabetes, difficult to treat bacteria, lung transplantation, or helping to get insurance independently.
So when should people with CF, teenagers, parents, start thinking about transition?
Well, I always think about transition as something that should start at diagnosis. I talk to patients who are diagnosed or parents of patients who are diagnosed by newborn screening and tell them about transition with the idea that patients are going to transition from a pediatric program to an adult program, that they're going to go on to college, get married, have families, and lead a very healthy adult life.
So are there guidelines or recommendations from the foundation related to the transition process? For example, when should parents leave the room? When should a child with CF go to the care center on their own?
Well, there are no specific transition points, and there are no specific transition guidelines, and that varies from center to center depending on the pediatric and adult programs that are involved. But typically, most patients transition somewhere between 18 and 21.
So how and when does a person with CF and a parent know that it's time to move or transition or transfer between pediatric care to adult care?
That is definitely a team decision. And so that's something that you're going to be talking to your physician about. As an adult physician, we actually rely a lot on the interactions between the families, the individual, and the pediatric team, because they really know your son or daughter best. That it varies a lot between individuals, right? Because there's some 18-year-olds who are going to be ready to transition, and there's other 18-year-olds who are going to need a few more years. So part of that is making sure that there's a preparation time to try to get there. I mean, the real ideal transition, I'm going to look at this slide right here, that talks about over time developing more self-responsibility. So we talk about a time of transfer between the ages of 18 and 21 usually, and sometimes that's forced by hospitals that require that individuals older than age 21 can't go into a pediatric hospital. But the key thing is to think about it like this slide, where beginning at a younger age, the individual with cystic fibrosis, this child starts to realize, hey, this is something I need to learn about, to take responsibility for, and to gradually gain more responsibility for as the parents provide a little bit of freedom. Truthfully, it's just part of growing up.
Well, you know what I find interesting about that slide, and that is the parents and families, there's always, it doesn't go all the way down to the bottom where it's completely the one person's responsibility. And I think that highlights that it takes a team, however you define your family for care. Would that be?
Yeah, well, actually, I think that's important. We did that on purpose because it's easy to think as a parent, I'm supposed to leave everything behind as my child becomes an adult. That's not true. We want to continue that support part. As a matter of fact, we encourage our adult parents when they first transition to come to clinic. We make sure that we see those individuals independently, but we want to have the parents continue to be a big support. Cystic fibrosis requires a team. That includes family, friends, and obviously the caregivers.
So somebody wrote in and they said that they were interested in how centers handle the transition. It sounds like it's a huge process. So tell me how the two of you, between the pediatric and the adult program for the Hopkins CF Center, how do you work through the process of transition?
It is a group decision, as we said, for the pediatric team to decide what patients are ready for transition, and what the transition process is something that takes place over many years. And you can think of goals for transition that have real concrete things that you can relate to, or patients can relate to. And I just have a few goals to share with you that we use. You know, for a 12 to 14-year-old, do they know what causes CF? Do they understand how the body is affected by cystic fibrosis? Do they know their medications? Do they know when they should take them? Do they actually take them? Do they understand the purpose of the medications? Can they perform airway clearance without help of parents, at least most of the time? And do they understand the choices that they make affect their lungs and their health, like smoking and drinking? And as patients get older, we expect them to take on more responsibility, to be able to recognize symptoms and describe them, to be able to deal with the clinic, to call the doctor or nurse about problems that they may be having, know about clinic appointments, be aware of medications and prescriptions, be able to talk directly to the caregivers and not have their parents answer all the questions, and then to be able to take care of their own equipment, their nebulizer, vest, and so forth. And as you move to the adult program, or as you get very close to moving to the adult program, there are more adult goals.
Right, so it's the things that we've already been talking about, that independence and that ability to interact with your caregiver, but some of those things can be to contact your CF health caregiver provider. And we never like it when there's young adults whose mothers or fathers are calling to describe symptoms. So the idea of learning to contact your healthcare provider directly to discuss these changes, to schedule appointments and tests, that can be a wonderful sign of independence. Refilling prescriptions, since those medicines actually don't magically appear in the cabinet. And then awareness of details about insurance and strategies for getting insurance, particularly as individuals get older and are going to be required to carry their own insurance.
Okay, these are great goals, but how do people with CF learn these things that you've just bulleted out? How do teenagers learn this? Who teaches them? Is it the parents' responsibility?
It's a combination. It's a combination of the parents. It's a combination of the parents and the care team and other family members that are going to understand the importance of these characteristics, the importance of these goals, and then instill that in the kids.
So can a teenager request transition early? Let's say they're 15. Can they say, I'm ready to go to the adult center?
We have not done that, actually. We've encouraged to sort of aim between the ages of sort of 17 and 21. I think it would be a good sign as long as there's a reason for wanting to do that. But in general, we feel like that's the best way to make sure that they get the best care. That group, the pediatric group, will still know them well. What we do is to say, let's keep building, let's go through those goals, make sure we're doing it. I think the key thing to remember is that these are goals. Mm-hmm. There's never any perfection. I mean, the whole goal is to increase self-responsibility over time. And these are some nice guidelines you can use to do that.
So we've talked a little bit about it. We talked about the goals. Give me a little bit clarity and give the audience some clarity. What is the parents' role in transition? We've talked about the goals for the kids. What about the parents?
We talked before, parents are crucial. So, you know, we're going to see patients maybe 4 times a year, maybe more, 6 times a year. It's the parents who are going to be seeing them every day and are going to be making the difference. And so we keep stressing this whole idea of not perfection, but increased self-responsibility. And that requires some self-discipline not to do those things for your child when you know that they're not being perfect about them. So John Wooden, who's a famous basketball coach, says something that we talk a lot about. And his quote is, "The worst thing you can do for someone you love is to do that which they could and should do for themselves." And I think this sums up the idea that in the long run, it's much more caring for your child if you slowly let them get age-appropriate responsibility, so that when the time comes when they really do move away from home, when they're away at college, when they've moved on to a job, that they're in a position to succeed and be an independent adult.
So any last-minute tips for the parent who's trying to get their child to meet these goals that you've outlined, but maybe the teen's health is not quite as good as what the parents knows it could be, or they know the teen's not doing quite what they should be, especially when they're away at college? Any tips for the parents to deal in this transition time?
That's a great question. This happens all the time. And I think it is a time where parents need to realize that gaining independence is probably the key thing, and that understanding what care is important and how care affects your health is something that's gained to some extent by experience.
And I might add as well that just to encourage. It's not easy, particularly if you're a sick teen, we want to be encouraging in clinic. Parents need to be encouraging and sometimes realize that a little bit of leeway might in the long run be helpful, since no one's going to be perfect.
Well, thank you, Peter. Thank you, Mike. I think what both of you have just emphasized is that transition is a process and it takes time. It starts at the beginning. And that when somebody goes through transition, it's not all the parents' responsibility, it's not all the teens' responsibility, but it is the full CF care team to take care of that. And anyone knows that it is a team effort, especially during transition. So I want to encourage you to learn more, talk with your CF team members. There's also a webcast on the Foundation's website called Building Life Skills to Manage CF that you may find helpful. The National Institute of Health has medlineplus.gov, which is information on diseases, conditions, and wellness, and they have information about transition. The hopkinscf.org is the Johns Hopkins CF Center website that has information. In addition to kidshealth.org, and you search on transition, has general information for kids, teens, and parents about different diseases and conditions. I want to encourage you to watch an archived CF education webcast. You can learn about CF research, lung health, lung disease, nutrition, germs, healthcare coverage, and more. Also, this webcast is a part of the Partnering for Care webcast series. This presentation series includes information about partnering for the care of your child with CF, as an adult with CF, when thinking about lung transplantation, what it means to be a CF Foundation accredited care center, as well as how to work with your CF nurse, your dietitian, your respiratory and physical therapist, your social worker, or your psychologist, so you or your child with CF can thrive. This concludes the CF Foundation Education Day, Partnering for Care, Transition to Adult CF Care. I would like to thank you for watching and submitting your questions, Peter and Mike for the very interesting discussion about transition and how to partner with your CF Care Center, Rick Vasta and the technical crew, Emily Ann Powell, Melissa Chin, and the CF Foundation for making this webcast possible, and Genentech for their unrestricted educational grant. Thank you.